If you're over 60, there's a good chance your heart has already survived several close calls you never even knew about. Not because you did anything wrong on purpose, not because you were careless, but because 5 ordinary things you do every single evening are quietly deciding whether tonight is just another night of sleep or the night everything changes. I've spent my career in operating rooms, elbow deep in human chests, watching hearts stop and start again under my hands. And if there is one thing that experience has burned into me, it is this. The most dangerous moments for an aging heart almost never happen in daylight. They happen in the dark, between midnight and sunrise. Nobody warns you about this. Nobody sits you down and explains that the innocent little rituals of your evening, what time you eat, what you drink, how warm your room is, whether you remembered a pill, are secretly rewriting your odds for the night ahead. So tonight, before you go anywhere near your bed, I want to walk you through exactly what is happening inside an aging cardiovascular system after dark, and the 5 ordinary evening habits that are silently working against you. Then I'm going to hand you a simple routine that undoes almost all of that damage, one that takes no special equipment, no expensive supplements, and maybe 20 extra minutes of intention evening. Stay with me until the end, because the last habit on this list is the one almost nobody has ever heard of, and it might be the most important one of all. Let's start with something most people never think about. Your heart does not clock out at bedtime. It changes shifts. In a young, healthy body, falling asleep triggers a kind of internal power down sequence. Blood pressure drops by somewhere around 10 to 20%. The heart rate eases off. Blood vessels loosen and relax. This nightly dip has a name in medicine. Doctors call it nocturnal dipping. And it exists for a reason. It gives the cardiovascular system a few hours of lighter duty, a chance to recover from the wear of the day. But here's the problem. As we age past 60, that nightly dip becomes less reliable. Arteries that used to flex and stretch with ease grow stiffer. The internal thermostat that regulates blood pressure starts to lose precision. Hormonal signals that once protected the heart overnight begin to fade. And so the safety margin, the cushion your body used to have for absorbing the small stresses of daily life, shrinks dramatically. During the day, your cardiovascular system has backup systems layered on backup systems. It can adapt on the fly, but overnight, especially after 60, many of those backups are offline. Your body is essentially running on a skeleton crew, and it stays that way until morning. This is precisely why cardiologists and emergency room doctors will tell you that the deadliest hours for heart attacks and strokes in older adults are not the stressful hours of a busy afternoon or the frantic rush of early morning traffic. They are the quiet hours, roughly midnight until 6 a.m., when the house is silent, the lights are off, and nobody's watching except the choices you made a few hours earlier. And that is the part that should genuinely surprise you. Those choices are almost never dramatic. Nobody's heart stops because of some rare, exotic risk factor. It stops because of small, forgettable decisions made in the 2 or 3 hours before bed. So let's go through them, one at a time, starting with the one that trips up more of my patients than any other. Ask yourself honestly, what time did you eat dinner last night? And what was actually on your plate? I ask nearly every patient this question, and the answers are remarkably consistent. Dinner at 8, dinner at 9, sometimes even later. A full plate, pasta, rice, a heavy cut of meat, maybe something. Fried, and followed by an hour or 2 on the couch, and then straight to bed. It feels completely normal. It's how most families have always eaten. But from a cardiac standpoint, this pattern quietly puts your heart under far more strain than you realize. Here's the physiology behind it. The moment you eat a large meal, your digestive tract demands a sudden and significant surge in blood flow. Your heart has to work harder to meet that demand. Blood pressure climbs, triglycerides, the fatty particles that trave L through your bloodstream, spike sharply within 2 to 4 hours of eating. Now picture what happens when you layer sleep on top of that. Your body expects the evening hours to be a gentle wind down, not a full-scale digestive operation running in parallel with the transition into nighttime recovery mode. Those two processes are fighting each other for the same resources at exactly the wrong time. For someone in their 30s or 40s, that conflict is a minor inconvenience. For someone over 60 with even mild arterial stiffening, it can be the spark that lights a much bigger fire. Multiple studies point to the same conclusion. Eating within 2 to 3 hours of bedtime is linked to higher nighttime blood pressure, more frequent acid reflux that can mimic, or actually provoke, cardiac symptoms, and a measurably higher rate of cardiovascular events during sleep. The fix here does not require a drastic diet overhaul. Aim to finish your main meal by 6 or 7 in the evening whenever your schedule allows. If a later dinner is unavoidable, keep it light, lean, protein, vegetables, and easily digested carbohydrates instead of anything heavy, fried, or drenched in sauce. Small shift, meaningful protection. Now let's move to something even more overlooked and honestly, one of the most preventable causes of nighttime cardiacs. Events I see in my practice: medication timing. If you're over 60 and you take medication for high blood pressure, and statistically more than 6 in 10 people in his age bracket do, the timing of that single pill may matter more than almost anything else we've discussed so far. Yet it's a conversation that rarely happens between doctors and patients, simply because there isn't enough time in a 15-minute appointment to get into it. In a healthy pattern, blood pressure rises in the morning, peaks sometime in the afternoon, and eases downward at night. But a significant portion of older adults, particularly those already living with hypertension, never experience that expected nighttime drop. Their blood pressure stays elevated through the night, or worse, it actually surges in the early morning hours before sunrise. This pattern has an official name, nocturnal hypertension, and most people have never heard the term, despite how dangerous it can be. Here's why it's so different from ordinary daytime high blood pressure. While you sleep, your arterial walls are not braced for sudden pressure, spikes the way they might be during an alert, upright daytime state. A pressure surge at 3 in the morning interacts with your arteries very differently than the same surge would at 3 in the afternoon. It is more likely to destabilize a fragile plaque sitting inside a coronary artery. More likely to trigger clot formation. More likely, frankly, to be the reason someone ends up on an operating table before sunrise. And if you die, our only dose of blood pressure medication is taken first thing in the morning. Its protective effect may have already worn thin by the time your body needs it most, in the dead of night. So here's something worth doing this week, not eventually. Ask your doctor directly whether shifting your blood pressure medication to the evening might be more effective for you specifically. This is not a fringe idea. Large-scale chronotherapy research, studies specifically examining how the timing of medication affects outcomes, has repeatedly shown that evening dosing of blood pressure medication can meaningfully lower cardiovascular risk during sleep compared with morning dosing alone. That single 2-minute conversation with your physician could turn out to be one of the more consequential medical decisions you make this year. Timing in cardiology is very rarely a minor detail. Now let's talk about something almost everyone treats as a joke, and almost nobody treats as the warning sign it actually is: snoring. Think about the loudest snorer you know. Maybe it's a spouse, maybe it's a parent. Maybe, if you're honest with your LF, it's you. That heavy, irregular, rattling sound in the middle of the night gets laughed off constantly, the subject of jokes, separate bedrooms, and gentle elbow nudges. In my professional opinion, after decades of treating cardiac patients, loud, chronic snoring in someone over 60 deserves to be treated as a red flag for heart disease until proven otherwise. Sleep apnea is staggeringly common and staggeringly underdiagnosed. Research suggests that roughly a third of adults over 60 have some degree of it, and the overwhelming majority walk around with no diagnosis and no idea what it's quietly doing to their cardiovascular system night after night for years. Here's what actually happens during an episode. Breathing stops, sometimes for 10 seconds, sometimes or closer to a minute, and this can repeat dozens of times in a single hour. Each pause E causes a sharp drop in blood oxygen. The brain senses the emergency and floods the body with stress hormones. Adrenaline surges. Cortisol rises. Heart rate spikes suddenly. Blood pressure jumps. In essence, the heart gets violently jolted awake while the rest of the body stays unconscious. And this cycle can repeat 30, 40, even 50 times before morning. The cardiovascular consequences of that nightly cycle are not subtle. Untreated sleep apnea has been associated with roughly a threefold increase in heart attack risk. It is strongly linked to irregular heart rhythms, including atrial fibrillation, which sharply raises stroke risk. Over time, it accelerates the stiffening and thickening of arterial walls throughout the body. And because all of this unfolds while the person is unconscious, most people have no idea anything is wrong until a major cardiac event forces the issue. The warning signs go beyond just loud snoring. Watch for waking up with headaches, feeling drained even after a full night in bed, needing to get up to urinate multiple times overnight, a persistently dry mouth in the morning, or waking abruptly with a gasping or choking sensation. If any of that sounds familiar to you or to someone sleeping beside you, bring it up with a doctor and ask about a sleep study. My advice to any patient over 60 who snores heavily and has any history of heart disease or stroke is simple and non-negotiable. Get evaluated for sleep apnea. It is not an optional lifestyle. Inquiry. It is a core piece of cardiac care. Treatment, most commonly a CPAP machine, is admittedly unglamorous. Nobody dreams OF wearing one. But the evidence behind it is remarkable. Consistent CPAP use is linked to measurable drops in blood pressure, fewer episodes of atrial fibrillation, and a meaningfully lower overall cardiovascular risk. One unglamorous little machine, an enormous amount of protection. Now, here's a habit that seems perfectly logical on the surface, which is exactly why it slips under the radar so easily. Plenty of people over 60 deliberately cut back on fluids in the evening. The reasoning makes total sense at first glance. Nobody wants to be jolted awake at 2 in the morning for a bathroom trip, and getting up in the dark raises the real risk of a fall. So the habit forms. No water after dinner, sometimes no water after 4 in the afternoon at all. I understand the logic completely. But from a cardiovascular standpoint, going to bed even mildly dehydrated is a genuine and underappreciated risk factor, one that almost nobody connects to heart health. When you're dehydrated, your blood becomes thicker, more viscous, and that thicker blood does not move through your vessels as smoothly. For a younger cardiovascular system, this is usually a minor inconvenience the body compensates for easily. But for someone over 60 who already has some degree of arterial stiffening or plaque buildup, it changes the equation entirely. Thicker blood moving through narrower, less flexible arteries is more pro-E to clot formation. Now stack that on top of what's already happening overnight. A naturally slower heart rate, slower circulation, and hours of complete physical stillness, and you start to see why heart attacks and strokes cluster so heavily in those early morning hours. Dehydration is a quiet accelerant sitting right in the middle of that equation. Thankfully, the fix costs nothing and takes 10 seconds. Drink 1 full glass of water, around 8 ounces, shortly before bed. Keep a second glass on your nightstand for if you wake up thirsty overnight. You're not choosing between uninterrupted sleep and a protected heart. You can have both, and the adjustment is genuinely that small. Now, for a habit, almost nobody connects to their heart at all, because it sounds far too simple to matter. The temperature of your sleep faster. Almost nobody thinks about it from a cardiovascular angle. But your heart genuinely performs best within a fairly narrow temperature window, and outside of that window, it is working harder than it needs to, every single night, without you ever noticing. If your bedroom climbs above roughly 72 degrees Fahrenheit, your body has to work continuously through the night to shed that extra heat. Blood vessels dilate, heart rate stays elevated, and you sweat more than you realize, which brings you right back to the dehydration problem we just covered. On top of that, your deep, restorative sleep stages shrink, and those are exactly the stages during which your heart does its most important overnight repair, work. Now swing to the other extreme, a bedroom colder than roughly 63 degrees Fahrenheit, and you get a completely different kind of strain. Cold temperatures trigger vasoconstriction, meaning your blood vessels tighten to preserve core body heat. As they constrict, blood pressure rises, and your heart has to pump against significantly more resistance. For someone already managing coronary artery disease or hypertension, that added nighttime strain is far from trivial. The sweet spot sits between about 65 and 72 degrees Fahrenheit. Inside that range, your body settles into what's called a thermally neutral state, blood. Vessels stay relaxed, heart rate stays low and steady, and sleep stays deep and genuinely restorative. It is, without question, the single easiest fix on this entire list. One adjustment on a thermostat, and your heart gets a measurably easier night. So now that you've heard all 5, I don't want you walking away with a list of things to worry about. I want you walking away with a plan. A simple, repeatable evening rhythm that protects your heart without asking you to overhaul your entire life. Here's what that looks like in practice. Somewhere between 6 and 7 in the evening, sit down for your main meal. Lean protein, vegetables, a reasonable portion OF carbohydrates if you want them. Not a feast, not a fast, just a balanced dinner at a sensible hour, giving your body 3 to 4 hours to finish digesting before you lie down. Around 7, take care of 2 things at once, your water and your medications. If you and your doctor have never specifically discussed the timing of your blood pressure medication, let this be the nudge that finally starts that conversation. For many people, shifting that dose to the evening provides meaningfully better overnight protection. Between 8 and 9, ease into a genuine wind-down period. A slow walk, a few chapters of a book, a relaxed conversation with someone you love. This is also the moment to put screens away, particularly phones, since the blue light they emit suppresses melatonin production and keeps your nervous system more alert than it should be right before sleep. By 9, prepare the room itself. Adjust the thermostat into that ideal range, crack a window if needed, and set a glass of water on your nightstand. These small tasks take less than 2 minutes combined, but they matter far more than that. Air size suggests, by 10, aim to be in bed. And if you or someone you love snores heavily or has ever been told they stop breathing during sleep, try shifting to sleeping on your side rather than your back. Sleeping flat on your back can significantly worsen airway obstruction, and switching positions alone can meaningfully reduce apnea episodes while you pursue a proper medical evaluation. Dinner by 7, water and medication check around the same time. A calm, screen-free wind down until 9. Bedroom prepared by 9, lights out by 10, sleeping on your side if snoring is part of your story. None of this requires special equipment, a gym membership, or a dramatic lifestyle transformation. It simply requires a small amount of intention applied consistently, night after night. I want to step out of the clinical explanations for a moment and speak to you plainly, because this subject deserves honesty rather than just statistics. I have stood in an operating room at 3 in the morning, holding a heart that stopped because a clot formed overnight inside a narrowed artery. I have sat across from families in waiting rooms. At dawn, family members who had absolutely no warning anything was wrong when they said goodnight to their loved one just hours earlier. In case after case, when you trace back what actually happened, the contributing factors were rarely mysterious or exotic. A dinner eaten too late, a blood pressure pill taken at the wrong time, or not at all. A bedroom kept too warm out of habit, a body that was quietly dehydrated for years without anyone noticing, an airway that had been silently struggling every night while everyone around simply assumed the snoring was harmless background noise. None of these are rare risk factors reserved for unlucky people. They are the ordinary texture of millions of everyday evenings. But repeated, night after night, year after year, that ordinary background noise can eventually become the heart attack that seems to come out of nowhere. Except it never really came out of nowhere. It built quietly for years in plain sight. If there is one lesson decades in surgery have taught me, it's this. Most of the damaged hearts I've operated on didn't fail because of bad luck. They failed because of missing information. Information the person simply never had access to until it was far too late to use it. You now have that information. The only real question left is what you choose to do with it tonight. Not next week, not after your next checkup, but starting with the very next meal you eat and the very next hour before you climb into bed. So let's bring it all together into one clear, simple action plan. First, finish your main meal by 6 or 7 in the evening whenever you reasonably can, keeping it balanced rather than heavy. Second, talk to your doctor specifically about whether your blood pressure medication should move to the evening. A 2-minute conversation that could carry outsized benefit. Third, if you snore, wake up exhausted, or have ever been told you stop breathing during sleep, get evaluated for sleep apnea. Treat it as essential cardiac care, not an optional nuisance. Fourth, drink a full glass of water before bed, and keep another nearby for overnight, so dehydration never becomes an invisible accomplice to a bigger problem. Fifth, keep your bedroom between roughly 65 and 72 degrees Fahrenheit, giving your cardiovascular system the thermally neutral environment it needs to actually rest, instead of quietly compensating all night long. I'd genuinely like to know, as you were listening, did you recognize yourself in 1 or 2 of these habits? Maybe even 3? If so, you are in very good company. The vast majority of people I've cared for over the years saw themselves somewhere on this exact list. The only real difference now is that you know precisely what to adjust, and you know why it matters. If this information felt useful to you, consider passing it along to someone in your life, over 60, who has never once connected their nightly habits to the health of their heart. A parent, a spouse, an older sibling, a close friend. It costs you nothing to share, and it might buy them years. Take care of your heart tonight the way it has quietly taken care of you every single day of your life, without asking for anything in return. Give it the conditions it needs, and it will keep showing up for you for a very long time to come. One last note before you go. Everything covered here reflects general medical knowledge drawn from current cardiovascular research and broad clinical experience. It is not a replacement for personalized medical advice tailored to your specific health history. Before adjusting any medication schedule, especially the timing of blood pressure medication, please speak with your own physician first. That's not just a formality. It's genuine advice, offered with the sincere hope that you'll be around, healthy, and watching the next one of these videos for many years to come. Sleep well tonight, and start putting this into practice before your head even hits the pillow.